Hi, it's Dr. Daniel from the Neuropathy Clinic at FixMe, and today I'm going to talk about the reason I do the in-office program, the reason why I do the online virtual program for patients who aren't close enough. And that's because I actually have a real sense of urgency. And what I mean by that is that neuropathy, type 2 diabetes are time sensitive, meaning the body can really only deal with these problems for so long before it breaks down. And so when we talk about neuropathy, we know it is always, number one, progressive, number two, degenerative. And so it's going to move forward, it's going to get worse. The thing that we don't know is how quickly and how much damage, permanent damage is going to occur. And so these problems, the neuropathy, type 2 diabetes, can be reversed many times if you get to them soon enough. And so a lot of times patients present initially with these symptoms and they're told by their physicians, just take this drug, insulin or metformin or gabapentin, and manage the condition. And all managing does is allows it to get worse. And if they had been counseled appropriately, if they had been given nutritional suggestions and eating guidelines and directed on how to eat appropriately, it would have been stopped. And along with these, of course, along with diabetes, most everybody that I've seen with diabetes, and at least 50% of the patients with neuropathy have diabetes, is we see high blood pressure, and that all ties into strokes and heart attacks. And these can be catastrophic events at the very least, and many times fatal. And so I have a real sense of trying to reach people, as many people as I can, as quickly as I can, to get the information into their hands that they need to get themselves turned around. And so if I seem a little bit wired and I'll even say it, spastic, that's because I do have I feel like I'm on a deadline, and that deadline is to get people going in the right direction so they don't need me, or they need me less than they would have if it's been 6 months or a year or 2 years of dealing with these situations. And so along those lines, if you know somebody who has just started pre-diabetes, give them the guidelines that I hand out. If you know somebody who's got type 2 diabetes and they don't have any other issues, let them know. We're actually starting an online program to reverse type 2 diabetes. Yes, it can be reversed. So again, I encourage anybody who has some of these issues going on to contact us. If you have people that you'd like to help, please contact us. That's exactly why we're here, is to get people on the right path as quickly as possible so that what is needed from us is reduced. And many times, if it was soon enough, the patients could do it entirely by themselves. Okay, thanks and have a great day. Appreciate you listening. We'll talk to you soon. Bye-bye.